Hey, everybody, welcome back to a special episode of the High Conflict Co-Parenting Podcast with Brook and Charlie Jewett. We are going to do a midweek or second episode here. I don't know, Brook, it's kind of an urgent topic with what's going on in the country. So we've got episode 78.5, COVID-19 and parallel parenting. So you found a way to kind of bring these together and help people. So let's jump into this urgent content.
Well, you know, there's something that's going on right now that is unprecedented in our lifetime. We're looking at things that are changing very rapidly. They're scary. It's no short of a disaster, and I'm not trying to be hyperbolic or anything. We're just all looking at things unfolding across the planet in ways that we have never seen happen in terms of travel, in terms of finances, in terms of sickness and death, and everybody's trying to get their head around some of this stuff. And
it's not small. I mean, I don't watch a lot of news, so I didn't hear the whole ramp up, but I was driving home today and they said they're closing Disneyland from March 14th to the end of March.
Right. Well, they've closed Disneyland. They've stopped the NBA for at least 30 days. They've done the same thing with Major League Soccer. The governor's really looking around and saying, you know, if there's a large gathering, we're going to shut it down. We've had, you know, large concerts that have been set aside for the time being, and we're looking at something that's going to impact us for some time. And the problem is we don't know how long, and we don't know how large this is going to get. So the reason for this is just to let's talk about it. Let's try to look at it from a place of just dealing with it, normalizing it to some degree.
Yep.
Because, you know, whether we're locked down in our house or whatever's happening in our world because we're sick, we're isolating, we're self-isolating, we've got to breathe and move through this as well as we can. You know, the global stress that this is causing is making things a lot worse, and the information that we're getting is continuing to unfold. So what I wanted to bring in here, because I have many clients that have you know, kids. Well, obviously the nature of what we do here is we've got parents that are co-parenting, that the children spend time with the other parent, and sometimes that is across country and sometimes that is across the street. But part of the problem that we look at and we deal with this is everybody seems to have a different perspective on what is right, what is wrong, what's the best thing to do for the children, I hope. And sometimes that gets a little bit distorted. So what we really need to start to do here is start to look for the higher perspective. You know, if the kids are going to travel, if they're going to go out into the world, if they're going to go to the other parent's house, you know, whatever these pieces are, if the kids are going to be okay, that's great. And what we're seeing is by and large, the kids, the younger people have a tendency to navigate this better. They may get sick, but they recover. It's not as hard on the people that are older or elderly. And the problem with this idea of let's put our child on the plane because they're going to be okay, we're going to fly them across the country is that who do they come in contact with? Are they carrying this? Are they going to spread this? Are they going to pass this on to a relative that this is going to infect, that's going to cause great harm? And the kid may be okay. The child may be able to function with this. But what we're seeing with this particular pandemic, and that's what they're calling it, is that it is easily spread. And they're asking us all to really look at what's important and to stay away from each other as much as we can in order to, what they're calling, flatten the curve and allow the healthcare system to keep pace with the cases that are going to come in. And that means that we've got to be able to slow down contact of what's happening and not to, you know, put this out into the community. You know, my idea my thought in this as I was thinking about this podcast today was this notion of do no harm. So that's what the people in the medical field are supposed to do. But I think that that's what we're supposed to do as well. We've got this strong need. We want to be able to hang out with our kids. You know, we miss them. We want them to be there. And what is the cost of that need that we're doing? And I really want to be clear here for everybody. I'm not telling you what to do. I'm not telling you what not to do. But what I'm asking everybody to do is tap on the brakes and really start to look at what it is that's important here in the big picture, not just for ourselves, not just for our children, not just for our family, our nuclear family, not just for our extended family, but for our community.
Yeah.
And to start to come into the conscious part of the terror of what's taken place for us. I mean, when things are, you know, when we're facing disaster, when we're facing existential stuff, we want our children with us. And there's a very strong driving factor in that. And I get it. But we have to look at, you know, in the big picture, are they really okay where they're at? But are they okay where they're at? And what's the cost of making a change? You know, this thing's going to pass. My grandson is, he's up in Washington, and we had plans to fly him down in early April to spend an extended weekend with us. And we talked about it. He and I talked about it. He and his dad talked about it. And we concluded that that just really wasn't a good idea. And to postpone that. And do I want to see him? Absolutely. Does he want to see me? Absolutely. But the risk, and again, and we talked about this, not just to myself, because, you know, I'm over 60, and to, you know, him possibly getting this virus and spreading it around, and him maybe even not getting sick because he's, you know, just a stud, just a rock star, you know, is a high possibility. So we wanted to really look at this, and what I want everybody to do is start to inquire about, just to begin the internal conversation. We talk about this all the time on these podcasts about, you know, what are the choices that you are making here? What is it that, you know, whose needs are we really looking at? Whose wants are we really looking at? And to get into the conversation that you have around your rights, you know, because whenever that's my right to have my child, that's my time to have my child, that's, I want them, is a really indication that we're not in the reality of the moment and what really needs to take place. That sense of urgency and the need for expediency is one of the red flags that I always look for. And this idea of rights is yours, mine, theirs, community. You know, let's slow this down and let's get into the higher perspective of what's really needed.
Right. It's not a time to be selfish, really, and demand our rights when we're not just a part of our family, but a part of the bigger family and a part of the world, right?
Right. And, this notion of our children's safety is, it has a lot of different looks to it, and we have to really, what would be the worst thing? I'm going to jump ahead here because this is the last question I wanted to ask in this, but I'm going to ask it now and then I'm going to ask it later. What would be the worst thing that would happen if I chose to sit down and do nothing right now? If I chose to just let whatever is happening right now happen, for my child to be exactly where they're at, with whom they're with, and for this to play out for the next week, month, 2 months, until this takes a dip, because it's going to take a dip. It's going to calm down. It's going to normalize. But then to come back and negotiate. I think a part of what is happening, and I look at this as an opportunity, because I truly believe that everybody that is in conflict around child custody and visitation, the parents want the best for the kids, and they want the children to be well, whatever that means from their perspective. And this is an opportunity to turn that perspective up. Say, okay, we're going to miss spring break this year. Maybe because we choose to really be easy with this, we throw an extra weekend over the summer, or we throw an extra weekend over Christmas next year. And the person that, has this child, is nurturing this child through this time, honors the person who's missing the time that they're supposed to have. And without give and take, but just give that back to them in a way that is maybe, especially for those of you that are out there that have some semblance of being able to see the higher perspective of this, to start to create a little bit of trust that if the child, we've had these conversations, the child doesn't want to go, and then the child decides, okay, I want to go, and then this comes up and we go, I love you and I want to see it, and let's do this later because that's important for you. I mean, the levels of trust that can start to create for the child, the levels of what is important for the person that's making those decisions, and the opportunity for trust between parents, even on a small level, becomes a possibility in places where things weren't possible. I've noticed a lot through the years that I've done this work, that in times of great stress and tragedy within family, where disasters have happened and people have been at each other for maybe years, these times are times where things sometimes change. And there's an opportunity to do that if we can step back and do this type of thought process.
Yeah. Can be quite unifying to go through something as a species.
Right. And there's a time, the planet, the societies have a tendency from time to time to have something happen that causes a reset. I have in my lifetime gone through probably 3 major recessions and looked at 9/11 and the things that have happened. And during those pieces of time, those expanses of time, there's been a lot of consolidation in the world where people have really come together and done things in ways and bipartisan ways and cooperative ways that have really helped right the ship. And we're always looking at, is this a feature or is it a bug? Just because it's difficult, just because this is a time and a place where I'm struggling, that doesn't mean that this is not absolutely the best thing that could be happening in the moment.
Yeah, right.
Yep. Right. So, looking for a place to find some common ground in a crisis. How to make choices when there's no communication. What I'm going to suggest to all of you out there when you're facing this, because again, I want you to hear clearly, I'm not giving anybody advice here. I'm just wanting you to go into inquiry and start to look at the bigger picture. And I think if and when you do that, the choices will become clearer for you. And how do we look at our helplessness in this? There's nothing like feeling helpless when everything is coming down around your shoulders and you don't know what to do, because frankly there's nothing to be done. There's this place where we're going to be looking at a financial crisis that's coming on the heels of this, when people can't get to work, when the restaurants are closed, when the basketball teams aren't playing, when the schools are shut down, when everybody is told to stay home and isolate. Something's going to change.
Right.
And we haven't seen this. Most all of the adults here have not seen this in their lifetime. And we're up against something that we need to gather ourselves and slow things down and understand that sometimes there's nothing to be done. We just need to sit down.
What's interesting about being in both sort of the health industry and the financial industry is our thinking gets a little crazy, where we think it's sort of a right to be healthy and live in this like amazing country, and there's a right for the stock market to be going up and have the longest bull run of history. We sort of forget it's not necessarily the norm. And even back to farming days, you'd have a whole crop where a bug came along and ate it, or we saw in California some cold times that destroyed entire crops. It's sort of the norm. Historically, what's not normal is to have 10, 15 years of prosperity and health in a row,
Right. Everything goes down, and it seems to regulate itself, peaks and valleys. When the peaks are moderate, the valleys are moderate. When the peaks are massive, the valleys are massive. And we've just come through a massive peak. And this is threatening to be one of the hardest hit pieces that we have ever seen, at least, again, in recent history in our lifetimes. So, this is about our kids. We can tell our kids, we can teach our kids a lot from here, in the choices that we make and how we deal with one another and how we deal with this crisis, and how they see us normalize it with them. So, if you were the parent that is expecting the child, during a period of time, relax. If you are the parent that thinks that this is normal, that we can go out and play and this isn't a big deal and all of that, let's err on the side of caution here. Let's not just be arrogant about, oh, this is not that big of a deal, and just let it slide. If you're right, that's awesome. But if you're wrong, that's devastating. And I caution everybody, I implore everybody that's listening to this to step back and to err on the side of caution with this stuff. We don't have to run around and the sky's falling and everything's coming undone. But the professionals, doctors, this all across the world are asking us to stay away from one another, to have, I love the phrase, social distancing as much as we can. And how unreasonable is that? Because the truth of the matter is this, we're being forced into it, whether we like it or not. We can be in resistance to it, but we're going to be in resistance to something that is by and large happening around us, whether we like it or not. Things are shutting down.
Yeah.
We're being told to work from home. We're being told to telework, if you would. We're being, kind of stay away from restaurants, and if you need to go to the store, get your food, but go home and cook it. If you need to get your pharmaceuticals, go to the pharmacy and get it, and then go home and wait this thing out. There's an upside here too, I think, for all of us. Is an opportunity to isolate a little bit and go inward. And this is also an opportunity for us to look at what's important in our world.
We may have another baby boom.
Right. That's just what we need.
Exactly.
And let's not be arrogant about, just saying, I know more than the professionals know here. The professionals across the world are telling us that we need to give this thing, we've got to flatten the curve. We've got to make sure that the contact is done in a way and people get infected, because people are going to get infected, but that we don't overload the health system.
There's some really interesting, I don't know if moral is the right word, but there's some really interesting choices that come out of it. I was listening to the, whatever, I don't even know what it's called, the health organization of San Diego, or wherever the health professionals are that are making announcements for the county of San Diego, right? And, they're saying at this rate, we'd fill up the hospitals by like mid-May in the whole country, basically. And a lot of the current approach is to help people to heal without taking a hospital bed. And it's not selfish or like someone else deserves it instead of you, right?
Right.
But there's a reality that at 47, if I take up a bed and recover, the person that didn't get the bed may not recover if they were 65 or 70 or 80.
Right.
And at least in our town, the government's paying for hotel rooms and doing all kinds of crazy stuff. It's like, well, if you're feeling sick or you need to isolate yourself, they're trying to make it possible to isolate yourself somewhere besides a hospital.
Right.
And it's not, I just think that's really interesting. It's an interesting global do unto others or global selflessness thinking, right? Communal thinking. Like a lot of us have close people that if they were suffering more than we were, we'd go, no, you, or even just giving a seat to someone on a bus, right? That's older than us or whatever. Like if one of us is going to be uncomfortable, let's let it be me, right? It's a very global macro version of that. Like, dude, there's limitations no one thinks of. See, I worked in Hawaii for 10 years. And in Hawaii, they know if the boats stop coming, they have 12 days of food. There's a very obvious limitation that they're aware of being an island, right? We're like that in other ways. And hospital beds and hospital staff, which, by the way, how quickly would hospital staff start dropping like flies if all they're seeing is sick people?
And if they don't have the supplies that they need to test them.
Yeah.
We're all in this together, guys. And this is a challenge to our personal levels of narcissism.
Yeah.
And to see, as a community, as a family, as a divided family, where we can rise above some of this stuff and go, okay, we're going to sit down. You know what? I'm going to go about my business. I'm going to go out into the world and I am going to go to work. I'm going to go to the store. I'm going to go to restaurants. I'm going to do what I do. But I am not going to force that will on my child or on the other parent. I'm going to allow this to err on the side of caution. And we'll work the details out for this on the other end.
It's a time to be conservative and communal, not controlling.
Right.
What do you want for your kids? I want my kids to do what they think is best.
Right. If
they call and I feel unsafe going outside, I'm going to stay at dad's or I'm going to stay at mom's. Right now may not be the time to waive the court order or go like, I think I'm proud of you for thinking through this and being willing to speak for yourself. Would be okay if we make up that time sometime, or I can take you out on next whatever. Right. Maybe a little bit of something, but just roll with it and edify them, right?
Right. Part of the reason we're here, and I just want to ring this bell, and there may be people that don't agree with this, but part of the reason we're here is because people ignored the warnings about what was coming, and we didn't get prepared for it, and now it's here. And the warnings are here. It's clear what's happening, and it's going to continue for a period of time.
And if we probably, it has to get worse before better, right?
Right.
We only have five cases in San Diego County. That's not a pandemic. There has to be some sort of a curve of up and down. I mean, they're using the words "we will have deaths" in our county, right?
Right. And the idea, and we know this to be a fact, that currently the only reason that we only have 5 cases here is because we don't have the testing to do it. And when we get the testing to do it, that number is going to explode. So again, boys and girls, let's just sit back and err on the side of caution with this. And let's not force issues about traveling with our kids, having our kids go to football games or baseball games or be in places of school, or have them in areas that they don't need to be. And if you are staying home and it's time to have your kids and you're not going out into the world and you're exercising caution, do it. Keep it normal.
Yeah.
Back and forth. But if you guys are at odds about how you see the world, let's all of us for now err on the side of caution with this stuff. And again, here's the question that I have for you as we kind of end this is learning how to navigate the helplessness in all of this, because that's hard. I mean, no matter what, a lot of us in this arena have had our fill of helplessness already, and this is just kind of like icing on the cake, if you would. But there's this other piece of what would happen. What would be the worst thing right now if I chose to do nothing? If I chose to let it be just exactly where it is and not force travel or my agenda on my children or the other parent in terms of being risky. Okay? Anything you want to add to all of this, Charlie?
No, but that line of thinking is really a treasure for people, and probably help people and be very therapeutic, because it can be applied to really anything that they're fearful of in these relationships or with their children. It's like, what's the worst thing that can happen? And then what? And then what? And then what? And I'd still be here breathing, and my heart would be beating. And no, wait, what's the worst thing that might happen? My heart would stop beating, And then what? Well, you always come to an I don't know, right? And do you know it's bad then, or that it would be painful? No, you can't know that, right? It's just, it's in our thinking that we're doing all the suffering. So I'm reminded when you talk of like stories, I don't know if they're true or not, of soldiers at odds at war, and then at Christmas they decide to take a break. They're like, let's just not fight today, right? I don't know, remember what you call it, a ceasefire or whatever?
Yep.
And this is similar. It's not celebratory. It's never Christmas, but it's because we need focus, right? And strangely enough, we need focus and to not be around each other, like you said, which is I've never seen this. I'm 47. I've never seen anything like that in my life. Kind of a worldwide call for quarantine, right? The introverts are having small private parties, just celebrating one-on-one parties with all their alcohol and toilet paper. They're going nuts. They ordered in from or from trying to remember what these grocery delivery services are, Instacart or whatever. They didn't even go out in the world, but they got all the alcohol and the toilet paper, and they're having little private parties. Right. It's the extroverts like me. They're like, well, man, they're canceling March Madness.
Right. All right, everybody, take care of yourselves. Be cognizant of what's going on. Take care of your children. Let's take this time to pay attention and take care of each other. All right?
There you go. Amen.
Thanks, everybody.